Hello, I'm Dr. Brandt Gibson, and I would like to take you a step further into our discussion of the types of peripheral neuropathy. With peripheral neuropathy, a malfunction of the peripheral nerves, the nerves outside the brain and spinal cord, can actually cause one of four different types. You can go small fiber sensory neuropathy, large fiber sensory neuropathy, motor neuropathy, and the autonomic neuropathy. What I would like to talk to you about today is another large fiber neuropathy problem, but this is the motor neuropathy, where it is likewise large fiber nerves that are affected. It is the A alpha and the A gamma nerves that are affected, and when they start to malfunction, what happens is the muscles don't work like they're supposed to. So these are the nerves that are going to the muscles to instruct the skeletal muscle, for example, on what to do, how to move, make the motions that we are trying to do. And motor neuropathy is probably the least commonly diagnosed peripheral neuropathy. It is often not considered a neuropathy and may not even be thought of. But it can be really, really problematic for individuals because it comes with weakness, it comes with inability to function normally. It can lead to true disability where you can't walk and you can't function and you're using canes or even progressing to wheelchair. It also can be indicated by severe muscle cramps and severe instability. All of these can be signs that you have a motor peripheral neuropathy. Now, the good news is there are things that can be done for motor neuropathy as well, things that have been shown to be very effective at improving the motor function or the nerve function to the muscles so the motor function can be improved. Before I go into that, let me give you a little bit of insight of what a motor neuropathy will do or why it's happening. So when it comes to nerves, they usually innervate something. They usually send a signal to something. In sensory nerves, they're taking the signal from a sensory organ, like the skin or ears or whatever, and they're taking this sensation back to the brain and spinal cord, back to the central nervous system. When it comes to motor nerves, it's the signals going to the muscles that are malfunctioning. And so what happens is when you interfere with the function of the signals going to the muscles, it's the same as if the muscle doesn't get used. I had some really good friends that exercised, worked out really, really hard, and they got really, really strong, and they built really large muscles through this process. But when they'd stop exercising, when they'd stop doing this, though, the muscle strength goes away and it starts to decrease, and you'll actually you'll switch muscle size for fat sometimes, where you can actually where you still look larger, but you're not as strong and you're more moving towards the obese type situation. And that's because you stop using those muscles. If you were to cut a nerve that goes to a muscle, what happens is you'll get severe atrophy of that muscle. It will get smaller, get to the point where it doesn't function. That's what's happening with peripheral neuropathy, with a motor peripheral neuropathy, is you're not getting the right signals to the muscles, and so the muscles, instead of continuing to grow and be strong and so forth, they start to weaken, they start to shrink in size, and they can be a huge deal. And with a motor neuropathy, this can lead to the inability to do even normal activities, normal functioning, getting up from the ground, being able to turn the lid to open a bottle, or even holding a glass or holding a child. All those things can be limited due to this loss of motor function. So it's important that you can treat that. And motor, like we said, motor neuropathy can be treated, and it's been very successful. And there's a couple different things that work really well. Exercise is very, very valuable for a motor neuropathy. It's also very difficult with motor neuropathy. But if you can exercise, if you can push it a little bit, initially you're going to find that you fatigue the muscles quicker, but they start to improve in their ability to function if you can continue to do that. Number two, we found there's a type of improvement of the nerves that happens from the MLS laser that we use for large fiber and small fiber sensory neuropathies, for example, will also improve the nerves or heal the nerves or treat the nerves going to the muscles. Now, as we said, peripheral neuropathy isn't healed, but you can treat and heal the individual nerves sometimes and get them to function more like they're supposed to, get them to almost function normally, sometimes even to function normally. And that's what we're trying to do with a motor neuropathy treatment with MLS laser. So nutrition, likewise, anything that's going to improve nerve function, anything that's going to improve nerve health will improve motor neuropathy. So nutrition, exercise, and MLS laser are the biggest ones that we use for motor neuropathy. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 401, motor neuropathy and what you can do for it. Thank you. And if you would like additional information, you can reach out and get your free copy of Peripheral Neuropathy